My name is Randerson. I am a board-certified comprehensive ophthalmologist and uveitis specialist at the Froedtert and Medical College of Wisconsin Health Network. I started my education here at a boarding school called Wayland Academy in Beaver Dam, Wisconsin. I then went on to college at Marquette University. I did a Bachelor of Science in both mathematics and biochemistry and molecular biology there. I graduated there in 2013. I then came over to the Medical College of Wisconsin for my medical doctorate and graduated here in 2017. I did an internship at St. Joseph Hospital through the Medical College of Wisconsin, and then I did actually my ophthalmology residency here as well through the Froedtert Eye Institute. So I've been at Milwaukee for a very long time and happy to come back and serve here. I did my fellowship in uveitis and ocular immunology at Northwestern University in Chicago, and that was in 2020 and came back here end of 2021. I see patients of all ages with uveitis, which is an autoimmune eye condition. It sometimes comes with other autoimmune conditions, but my patients range anywhere from very, very young. I see patients as young as 2 years old over at Children's Wisconsin at my specialty clinic there. But I see mainly adults here at the Medical College in Froedtert, anywhere from the age of 18 and beyond. My uveitis clinic has a wide range of diagnoses in it. I see everything from anterior uveitis, which is uveitis at the front of the eye, in front of the pupil, to intermediate uveitis, which is inflammation in the gel of the eye, and then also posterior uveitis, which is in the retina at the back of the eye. I also see comprehensive patients, so general annual exams for glasses and also cataract surgery at Moreland Reserve in New Berlin. In my uveitis practice, I focus on a number of different types of uveitis, but the hard thing about uveitis is that it involves more than just the eye. It involves the entire person. So uveitis can affect this very small organ on the inside of the eye, but often it comes with systemic disease associations. These things can range from irritable bowel disease, so I work very closely with GI, also with other rheumatic conditions like lupus or sarcoidosis. So I work as a very collaborative physician with the interdisciplinary network throughout Froedtert and the Medical College of Wisconsin, often with many other specialists with patients. So things can get very complicated for my patients, and I try to make sure that we can get things as simple as possible for them and explain to them what we're dealing with, what our next step is, and what our action plan is going forward. Frequently, I think for my patients many years down the line, so they may not understand why I'm saying or talking about something right now with their vision, because their vision is great, they're 20/20. Often I'm thinking about them 15, 20 years down the road, because uveitis can be a devastating condition. It can make people lose their vision, so I work with them from a very young age or as soon as we find out that they have the condition to try and save as much as we can. In my comprehensive ophthalmology practice, I see patients of all ages, generally adults though. We see them for annual exams, so I do everything from glasses to following other kind of chronic conditions, help them with treating things like glaucoma or their diabetic retinopathy. I also do surgical services through my comprehensive clinic for cataract surgery and helping them improve their vision so that they can have a better chance at seeing if they've developed cataracts going forward. So my practice philosophy is really to listen. So my special quality that I always had as a kid was listening to stories from people. I really love absorbing and listening. That comes both with working with patients when we're talking in our conversation, but I also do a lot of reading before I actually meet the patients. I'm the kind of doctor that before you come to see me, I've sat down and read through as much of the chart as I can. For my younger patients, that can be very short, but sometimes for some of my more complicated and my older patients, that means that I've been in your chart for about 5 to 8 hours before I've actually met you. And that means that I'm kind of connecting dots all the way across your care. One thing I like to tell my patients is that I cross the T's and dot all the I's as we take care of them. So if that deals with the eyes and if it deals with their uveitis, something that I'm focusing on with them in their philosophy is really listening to what the current problem is now. And then where can we go based on what I've read about you or what we've talked about to help you the best based off the current concern. Outside the office, I do a lot of things. I'm I guess a jack of all trades. I have many, many hobbies. So depending on the year that you're talking to me, I may have picked up something different, but the constants are that I'm a big geek. I like to play a lot of video games and I do a lot of reading. And then in my travel time, I do a lot of scuba diving. So I travel all over the world and do scuba diving in as many places as I can. I take a lot of underwater photos. So if you have any questions about or you want to take a look at, I can show you sharks from the Caribbean or turtles from down below if you want to take a look. So that's what I do with a lot of my free time.